Day in, day out, Kenyans appear to be dropping the ball on prevention measures meant to check the spread of COVID-19. Take, for instance, face masks. The government directed that anybody found without a face mask will be arrested. A spot check on the streets revealed a total disregard of the same, with vendors who had started minting money from the mask business now lamenting the decline of what had become a solid money-making venture.
Watu walikuwa wananunua maski na wanavalia zaidi. Lakini kwa saa hii, watu hawanunui maski sana, wameshazoea. Sijui kama ni vile watu waliambiwa hata paipai ilionekana ikiwa na corona, sasa watu wamepuuza.
Sasa ni Mungu asaidie watu wake.
Inafanya Wakenya wanahangaika nje, ukiona saizi wanatembea unaona wamama wanahangaika na magunia hapa nje. Ni kwa sababu hawana mahali kitu ya kukidhi mahitaji ya kila siku.
Unapata kama mahali tuko saizi ni polisi anakaa na shinda anakuja anakumbusha watu wanastahili kuwa 1 meter. Yaani watu hawachukui hiyo measures.
Ukienda pale Kawangwale, nyumba zinashikana hapa kwa hapa, aste kwa aste. Ukienda barabara watu wameshikana kushikana. Si kupenda, ni mazingira.
The Ministry of Health concerned about the casual manner in which Kenyans continue to treat the threat posed by the virus despite positive cases increasing rapidly. Health CAS Dr. Rashid Aman says flouting all the measures at a critical moment such as these amounts to rolling the wheel backwards.
We understand that as human beings, yes, we will feel fatigued. But we should not allow that fatigue to make us break the restrictions and rules that have been put in place, because we will simply be turning the wheel backwards if we do that.
A spot check in several counties showed face masks continue to be a challenge, while hand washing points now remain idle as Kenyans no longer find them useful. The stay-at-home directive appears to be past tense as streets fill up. Many claiming they do not have food to stay indoors and are yet to receive government support. In what appears to be a change of tack, locals here were receiving foodstuff at the Trans Nzoia's County Commissioner's office worth 14 million shillings to help them stay at home as positive cases begin to rise in the Western Kenya region.
Operation itakuwa kali sana. Ule mwana bodaboda ama ule mwananchi ambaye atakuwa anaweka mask, basi tutakuwa tunamshughulikia vilivyo.
And the way they treat Kibra and the way they treat Mkuru kwa Njenga, the same way they need to treat Saboti constituents.
The ministry insists that regulation may be tightened if Kenyans fail to adhere to what is in place. Today, the ministry recording the lowest figures for this week with 14 people confirmed positive.
In the last 24 hours, we have tested 922 samples, out of which 14 have tested positive for COVID-19 disease. All 14 cases are Kenyans. This now raises the number of those who have tested positive in the country to 621.
10 people were arrested today in Embu for allegedly sneaking out of Kilifi County that is under cessation of movement orders. They had evaded all the roadblocks along the way. Meanwhile, the ministry today received personal protective equipment for frontline workers, with ABSA Kenya CEO Jeremy Awori, who is also on the COVID-19 National Emergency Fund, saying the equipment is to be distributed at the Kenyatta National Hospital, Mbagathi, Kenyatta University Referral Hospital, and the Coast General Hospital.
We are here really to donate a humble donation of 220,000 masks. These are 200,000 medical surgical masks, and then another 10,000 N95 masks, among others.
Stephen Letoo, Citizen TV, Nairobi.